my name is Dr. Magoha, and today I'll be taking you through diffuse intrinsic pontine glioma. Diffuse intrinsic pontine glioma is an aggressive type of childhood cancer that forms in the brainstem. They are very rare and almost always occur in the pediatric population. However, they have been described in adults as well. To avoid the high morbidity and mortality associated with this condition, DIPG must be promptly diagnosed and treated because regardless of its histopathology, it follows a malignant course. More than 2/3 of brainstem gliomas are DIPGs. There are many theories on how these form. However, one of the most accepted theories for the development of DIPG is a mutation of the H3 gene, in which mutations in the N-terminal tail of the histone H3 gene have been found in midline pontine high-grade gliomas at a high frequency. The H3K2 mutation and loss of the H3K2ME3 are of paramount importance since it likely represents the first genomic event leading to the transformation in these tumors. The classic presenting triad in DIPG is only present in about 50% of patients. This includes long tract signs, cerebellar signs, and cranial nerve neuropathies. The clinical course for children with DIPG is rapid. Most symptoms start less than 4 weeks before seeking medical attention. The symptoms are caused by dysfunction of pontine structures, including the long tracts and cranial nerve nuclei. Diplopia is usually the first sign, which is secondary to abducens nerve palsy. Damage to the facial nucleus will produce facial weakness or paralysis, and damage to the long motor tracts will produce weakness and hyperreflexia. Dysfunction of the cerebellopontine connections will cause ataxia, dysmetria, and dysarthria. Diagnosis can usually be made radiographically through MRI. They have a diffusely expanded pons at their epicenter, which extend into the medulla or the midbrain, and lack a focal or an exophytic component. Engulfment of the basilar artery is commonly seen in these tumors. Biopsy is generally not recommended because there is a high risk that a biopsy procedure would cause additional neurologic deficit. Also, biopsies generally have no effect on the patient's treatment, which consists mostly of palliative chemotherapy and radiation. Prognosis is generally, unfortunately, dismal. Thank you for your attention and have a blessed day.